Yeah, thank you so much, Gillian, for that introduction, and thanks everyone for joining us today. It's really exciting to be here and talk to you about the findings from this research. We've had a very good time doing this piece of work. So, as Gillian said, the study was looking at what we try to call like honest conversations about alcohol on Mumsnet, so sort of lay discussions about alcohol use during pregnancy. And just to say, we have no conflicts of interest to declare, but our salary support and funding sources are listed on the slide there. So I'm going to hand you over to Rachel, but I'm just going to give you a little bit of an overview of what we're going to talk about in this presentation. So we'll just start with setting out the scene in terms of public health guidance and alcohol use during pregnancy and the sort of theoretical underpinnings relating to conceptualizing risk in pregnancy and normative ideals of motherhood. Then just sort of talk you through the aims of the study, the methods, and dig into the key findings and discussion, a few discussion points, because we're quite interested to hear what people have to say, obviously in the Q&A at the end, and just give a few implications for research and practice. So without any further ado, I will hand over to Rachel to unmute, and then I will try and progress the slides.
Brilliant. Thank you so much, Lisa, and thank you for the very warm welcome. So I'll be providing the briefest of overviews of the background of our study before we get into sort of the data and that type of stuff. Can I have the next slide, please? So I'm sure most of you know the first real shift in UK policy which solidified a precautionary approach is the 2016 update to the Chief Medical Officer's low-risk drinking guidelines. And again, as some of you might know, this update was not prompted by any new emergence in evidence, rather as the report from the guidelines review noted, simplicity and clarity in providing meaningful health messages to the public was considered very important. So this report also noted that the previous iteration, so from 1995, had been interpreted by some as an encouragement to drink during pregnancy. So that kind of pushed forward a review. The 2016 change also expanded who a precautionary message is directed to, moving from women who are trying to become pregnant or are at any stage of pregnancy to those who are pregnant or think they could become pregnant. Can I have the next slide, please? But awareness and implementation of guidance are different to just mere publication. So examining this, there was a survey conducted 1 month after the CMO announcement, and 71% were aware of the CMO guidelines, though only 8% knew what they were. And this was a general population sample, not specifically solely about the alcohol, the pregnancy guidelines. So in a similar study which sought to assess guidelines awareness among pregnant women in Australia, where abstinence has been advised since 2009, 64% of pregnant women surveyed were aware of guidelines related to pregnancy and alcohol, and of those, 78 knew what the recommendation was, which was abstinence. However, the study noted that awareness of the guidelines made no significant difference on whether individuals chose to drink. In the UK, implementation was not seamless and corresponding to professional bodies' advice, and this kind of led to conflicting advice being available and relied upon by midwives, as Lisa has previously researched. Can I have the next slide, please? So the subject of alcohol and pregnancy has been studied from a range of different disciplines. There is a body of sociological literature speaking to the social world in which women and pregnant people make decisions in. Some research speaks to this dual role that women are thought to fulfill when pregnant, both on the one hand protecting their pregnancy from risk, while on the other being treated as the biggest risk themselves. This, for many researchers, has led to what they describe as a demand for complete risk elimination in pregnancy, even if this is to the detriment of the pregnant woman herself. Risk is thought more of in terms of individual terms and as individual responsibility. And biomedical technology has played a part in changing perceptions around the personhood of the fetus, so it being thought of as a distinct entity with its own interests, which could sit in opposition to its mother's interests. And more recently, we've seen a real emphasis in research placed on risk communication and pregnancy. So this third bullet point we've listed speaks to a paper published from the risk study, which was conducted out of BPAS. And this stressed the importance of risk communication that respects women's autonomy and trusts them to make decisions about their own pregnancy. And found, some individuals are happy to adopt a precautionary behaviour without discussion, whereas others may want a thorough examination of the evidence base. Can I have the next slide, please? So we've listed this quote here written by Annie Taylor at Edinburgh and her colleagues, and we really think it sums up this expectation of behaviour and the impact that this has on decision making. So importantly, this work that Annie Taylor conducted, it focused on accounts of those who identified as drinking at high risk during pregnancy, and it focused on the social context in which women live. And Taylor and her colleagues draw on the literature that we've sort of previously hinted at, and that argue mothers drinking is often problematized because it can be seen as a cultural challenge to these notions of quote unquote good mothering. They know women are expected to exert control over their risky, unruly bodies throughout pregnancy by following government guidelines, and those who do not can be considered, quote, irresponsible mothers. Can I have the next slide, please? And just lastly, before we delve into the methodology, we'd like to situate our project within this sort of growing discipline of motherhood and online as well. So briefly, many researchers are pointing to the utility of online forums, so specifically as a place where posters can share their views and experiences anonymously. Some have noted that users are able to talk about more, quote, taboo topics, so for example, maternal regret. And we argue that this could extend to behaviour that could be considered, quote unquote, irresponsible or going against these ideals of motherhood. And further, some researchers, such as this third bullet point as well, have identified narratives and framings that could help professionals engage with women based on the questions they ask online. So that's this very good French study that we've listed there as the third bullet point. Back to you, Lisa.
Thank you. Right, so I'm just going to go through some of the methods. As Rachel has already hinted at, there's been research into this idea of motherhood online and sort of certain topics being discussed online, but we didn't find any research in the UK, at least, or in many countries that looked at alcohol use during pregnancy specifically within these sorts of support forums. So that's what we set out to do, to really gain an understanding of how these topics were discussed. So first of all, we were interested in what topics were discussed in relation to alcohol and pregnancy, how they were discussed, and how specifically risk from exposure of alcohol during pregnancy was framed. I am not going to talk about this in detail, but just to give you an idea of how we did this. So we used the topics for threads on Mumsnet that were about pregnancy or about conception. So within these, we searched for the word alcohol from 2016 up until the end of 2021. So there were far too many threads that contained the word alcohol to actually go through within the time of this project. So we aimed to sample half of those, well, approximately half of those, by selecting particular months of the year where we know that people tend to drink, so, for example, during the summer or over Christmas. We then screened them for eligibility because the post could have been about anything and just contain the word alcohol but not be about alcohol. So we included posts that included advice on current or planned consumption, discussions about safe amounts, harmful effects, or about drinking guidelines, or otherwise about advice. So we went about the analysis in a two-stage fashion. So we first of all wanted to look at what was talked about and then how it was talked about. So the first stage was a content analysis of sort of the characteristics of each of these original posts, also known as OP. You learn a lot about acronyms on when you hang out on Mumsnet. More to come on that. We also looked at the topics and the purpose of the original post to kind of get an idea of why people went on the forum to start with. The second stage was a discourse analysis. So we started off by doing inductive coding of each of the posts. So everything that was responded to the original post, so not just the first one, and followed the approach by G, in which we tried to sort of unpick the discourse in relation to significance, activity, and identity to really try to get under the surface of what was said and how it was said. We obtained ethical approval from the research committee here at Edinburgh, and just a few words on the ethics. We aligned with recommendations for online mediated research, and we've adopted a very conservative approach. So we've only used posts that were accessible without creating an account on Mumsnet. And in the presentation of the findings, we're not using any usernames or full verbatim quotes. So just to make you aware that in this presentation, there are some verbatim phrases, like key phrases, but not full sentences. So where there are full sentences, they've been paraphrased. So going through the findings then. So there were a total of 73 threads that were eligible, and they had a total of so the original posts to these had 1,554 replies. So there was quite a lot of discussion going on there. And the discussions tended to last a day, but interestingly, some people followed up after a long time, either to say what had happened as a result of their own post, or responding to someone else asking how did it go with your baby, if someone, for example, had unintentional exposure and wanted to sort of advise. So the purpose of the post, which is not particularly surprising for a sort of peer support forum, but it was mainly to seek advice, seek opinions and experiences, and seeking reassurance. Very few were specifically about seeking information. When it came to the topic of the original post, it was actually quite interesting that not that many were about consumption during pregnancy, but about exposure before knowing, drinking while trying to conceive is what TTC means. And the third most common topic was low and no alcohol products. Just to give you an idea of the discourse analysis then, so we identified 3 themes of discourses, which you see here, and I'm not going to go into all of it in a lot of detail, but just to give you an idea of what this covered, and just to say as well that there was overlap between these, so they're not sort of mutually exclusive. So to summarize the first theme, importance given to evidence, we divided this into sort of official and anecdotal evidence is what we ended up calling it. Official evidence being guidelines, academic research, and health professional advice. And official sources of evidence or information were discussed, but few actually explicitly cited the guidelines. And when they did, they didn't refer to them as the CMO guidelines. They talked about the NHS advice. But that's not to say that the abstinence message in the guidelines weren't there. It was kind of implicit in a lot of the discussions. When it came to evidence around harm from low to moderate drinking, there was no consensus on what the evidence shows. And when it came to personal opinions, again, this is a peer support forum, so of course, peer support weighs heavy here, but we found that it was the most commonly cited and sought type of information or evidence, and it really was valued highly by the posters. So, as I said, there wasn't really consensus around the evidence. There was also a split opinion regarding the guidelines and this message where they were discussed. So some felt that it was scaremongering, others felt that it errs on the side of caution, and that's absolutely appropriate. When it came to academic research, it was often used to sort of bolster or confirm existing views rather than inform a decision. So people tended to come with what they wanted to do anyway, or how they thought about something, and then the evidence that they've found or had, they kind of back that up. And there were 2 situations in which we found that people were recommended to speak to health professionals, which was situations in which people had had unintentional and or low exposure of alcohol, and they were feeling very anxious about this, in which others will respond saying, well, you should speak to your midwife. The other situation were people who had had significant exposure during pregnancy because for various reasons they had found out very, very late in pregnancy that they were pregnant, because they, for example, had been told that they couldn't conceive, and suddenly they found themselves pregnant and were very worried about this. Interestingly, those situations, they received a little bit more compassionate responses, I would say, whereas some of the other ones where there was a lower level of exposure, people sometimes sort of suggested, well, you might be overreacting, but do speak to your midwife if you are worried. And there was an implicit understanding that health professionals should be involved if there was heavy exposure. We did find, though, that there were some occasions where health professionals hadn't advised abstinence, but for example, as you see on the screen, where someone was saying, well, the midwife was laughing at the idea that small amounts could cause harm, or accounts like it would be 0 chance that small amounts would cause any harm to the baby. When it came to anecdotal evidence, as we called it, it mainly focused on trying to conceive an exposure in early pregnancy, and where people were expressing this and expressing that they were feeling worried, they used very emotive language. For example, saying, I feel guilty, I hate myself. But those who responded to these posts tended to provide reassurance and sort of say, well, it happened to me as well, emphasizing also that it happens to a lot of people, but my kids are now bright and bouncy, or they're very, very advanced, they're perfect, nothing's wrong with them. And others also leaned into a more humoristic way of responding to this, where they were sort of saying, well, my baby wasn't born with 2 heads, or my hangover is now a 7-year-old, to sort of downplay the risk that or the sort of concerns that people were feeling. And those who ended up responding to these reassuring messages felt that they were, in fact, reassuring, and that they put their mind at ease. And I think what's interesting here as well is that these expresses of worry really underlines or aligns with this idea of responsible motherhood, and showing others that they do care about this, and they did feel that it was something that caused them a great deal of concern. Then we came to the theme of risk, and really trying to unpick what this means. So we identified that there were ways in which posters conceptualize risky drinking, which was by both, not in the same post, but some identified with the minimizing a minimizing way of differentiating risky drinking, which they did by sort of aligning risky drinking with those who drink at high levels. The other way of engaging with this type of framing risk was by maximizing risk, which underscored alignment with the precautionary principle by attributing risk to any drinking. And then finally, heavy drinking was discussed in some of these posts, where it was more about the others. So other people are drinking at risky levels, and that was associated with dependent or problem drinking. So the minimizing risk discourse, as it were, kind of differentiated that there's no problem with drinking small amounts, and that was emphasized by using specific words to sort of say, well, it is just the one-off drink or the odd drink, which wasn't considered as risky. And this discourse mainly worked to reassure posters, and what we found here was a linguistic tool we called conditional reassurance. So people would say things like, well, you've stopped drinking now, so there will not be any harm to your baby, or as long as you haven't drunk to excess, it's fine. What was interesting here as well was this poster spoke with a lot of conviction about providing this reassurance or this advice, but they didn't necessarily provide any evidence for why they felt that there's 0 risk or 0 chance that your baby has been harmed at this stage of pregnancy. The maximizing discourse attributed any level of drinking with harm, and outcomes were perceived as severe. The emphasis was on that it's not just when you drink heavily that harm can be done, and alcohol was described as a poison or a teratogen. And here we identified a different rhetorical tool that we called perceived equivalence. So someone would say, well, you wouldn't put alcohol in your infant's bottle, so why would you drink when you're pregnant? And again, this idea of good motherhood and responsibility came into this discourse as well, about wanting to avoid risk for the sake of the baby. So then this other framing of risk in terms of heavy drinking, it considered that the type of drinking that can cause fetal harm really was different to occasional exposure. So people would talk about binge drinking or continual exposure, or quote unquote alcoholics. And references were often made with quantities like, well, it's fine because you're not drinking a bottle of vodka a day, and that was the kind of extreme measure that was seen as harmful. And FASD was raised as an outcome here in this discourse from heavy or sustained drinking throughout pregnancy. And those who had experienced a high exposure during pregnancy, as I mentioned before, because they, for example, had been told that they couldn't conceive and then found out late, they expressed being in an emotional storm of fear or having caused irreversible damage, and expressed a lot of distress. So finally, and I must admit, as an alcohol researcher, this to me is probably the most interesting theme. So this was really about how posters differentiated risky and understandable exposure. So posters who had experienced unintentional exposure often provided a lot of detail as to why that had happened. So they were providing justification and distancing themselves from what they might have perceived as blame, or were worried that others would feel that they could be blamed for. And those who had chosen to drink often emphasized the small amounts that they consumed. And within this, we also identified that the sort of drinking culture in the UK and drinking behavior before one knew that they were pregnant, intoxication was both expected and accepted within certain events, which kind of played out in these events that we saw about unintentional exposure. So when we're talking about justifying here, we mean that people were providing justification because they felt that they might have done something quote unquote wrong, and that they were expecting sort of judgment from others. And we created this theme because of how the exposure was talked about in a very particular way. And it became clear here as well, which I will talk about in the final sort of sub theme, but that the non-pregnant normalized drinking culture provided sort of understandable exposure. So many posters gave sort of a lot of justification to not just the event that had where they had been drinking before they knew they were pregnant. So instead of saying I was drunk before I found I was pregnant, they would say I was in London on a hen do drinking gin, and like providing a lot of extra context as to why they were drunk or had drunk to excess at that stage. And posters often made a case for that they would have acted a lot differently if they knew that they were pregnant, making sure that they didn't mean this to happen, and that they shouldn't be blamed for it, with phrases like "in my defense." And this specific discourse really worked to, where the function of it was to reassure women that unintentional exposure is common, and it doesn't necessarily have negative outcomes. But it also worked to create shared experiences by using phrases like "obviously no one wants to take risk," or "obviously you wouldn't have drunk if you knew that you were pregnant." But then on the other hand, we had people who had chosen to drink, and often they made they put a lot of emphasis on the amounts that they have drunk. So they would say, oh, I'll just have a sip from my husband's drink, or a gulp, or a tiny bit of alcohol, whereas the words that people used about their drinking before they got pregnant might have been, oh, I drank huge amounts before I found out. So it was a big contrast there. And the language used signaled that posters were still aligning with sort of appropriate behavior, and perhaps following quote unquote rules, and some making sure that they came across as informed, that they knew about or that they felt that they weren't taking risks because of the amounts that they were drinking were seen as non-risky. And even here, there were some people who weren't quite sure about whether there would be judgment for their decision to drink. So one poster, for example, saying, well, I'm not looking for judgment here. But you still saw some people who were making very clear that they had chosen to drink because they felt like it, or they fancied a drink, rather than having to justify it beyond that, whereas others justified it again with, it was Christmas and I had, you know, half a shandy. Like, they needed to really justify both the occasion and the type of drink that they had. And then finally, which I think is, again, in terms of thinking broader about alcohol consumption, this was what I found really interesting, was the pre-pregnancy drinking, and how people were absolutely happy to talk about heavy drinking before pregnancy, because it wasn't seen as something that was a problem. Binge drinking wasn't necessarily considered as a problem in this context. So the way that people then engaged with this discourse was by making light of binge drinking, by using these terms, which some of them I had never even heard were, you know, a synonym for being intoxicated. And within this, there was a bit of an engagement with a dichotomy of risky drinking just being quote unquote alcoholism or dependent drinking, but not recognizing any sort of drinking patterns in between. And the main activity here was, again, to sort of reassure those who were worried. And again, occasions were often justified. Like, I was at a hen do, I was, again, in London, or I was drinking gin, so it's absolutely fine. So I'm going to just give the non-existing microphone back to Rachel.
Thank you.
You're still...
Yeah, I'm still here. So, so to provide a brief discussion. So it is clear from our analysis that many posters, as sort of Lisa's alluded to, engaged in discourse which helped create an identity of behaving responsibly, sort of quote responsibly. And that this perception of being seen to be doing the right thing, to be seen to be behaving responsibly, was clearly important to many posters. And yeah, responsibility can be considered a tenet of many accounts of good motherhood. So this idea of good mother is responsible, they're doing the right things, quote unquote, right things. And so efforts to demonstrate responsibility were both found in posts where individuals abstained. And again, sort of, we recall Taylor's quote about being responsible following the guidance. You know, that's how they demonstrated that. Whereas others, you know, were very open about, they weighed the evidence, they made their own decisions and kind of rejected the guidance. And for them, that was behaving responsibly. So to us, it appeared that posters brought their own ideas about what is considered risky, what is considered responsible to any interactions on Mumsnet. And again, interactions with the guidance itself. And this underpinned what they considered appropriate, or quote unquote appropriate behavior. And it is worth noting, as Lisa discussed, that drinking culture is highly influential in how acceptable, in quotation marks, transgressions of the expectation of abstinence are justified, and that this isn't necessarily considered a marker of bad motherhood. Again, we heard sort of inklings of quotes about, well, if you had known, you would have behaved differently. And that sort of, again, it's all hinged on this expectation that, you want to do the right thing, quote unquote, and in this case, it would be an expectation of abstinence. Can I have the next slide, please? So again, yeah, looking at this influence of abstinent messaging. In terms of the influence, it is clear that there has been some impact. The expectation of abstinence is recognised by most of the posts and the users that we analysed, but there is not universal support for it or such a precautionary approach. And that's not to say that public health guidance isn't needed or desired. Again, most posters were seeking sort of advice. They were seeking that, what to do. But we need to understand what impact such an approach has and how best to communicate information about alcohol and pregnancy. So other aspects of the guidance, mainly the category of those who could get pregnant, guidance, are more challenging for some posters. If we sort of recall the wheel that Lisa showed about the high proportion of questions around the trying to conceive area, that type of stuff. And it makes this simple message difficult to manage. It's clear that this is not a homogenous group, that it can be particularly difficult among posters who deal with extended periods of trying to conceive. And further, when we consider the overall drinking culture where binge drinking is sort of normalized, it means adhering to guidance as written can be challenging. And the next slide.
Yeah, so I just wanted to highlight a couple of what we think are the implications for research and for practice. So I think, our study adds to the growing literature on this field of, risk communication about health and pregnancy. And I think we do need to develop more research that seeks to understand how we effectively communicate guidelines in ways that resonate with the target audience. And also, as Rachel already said, how to communicate the evidence. I think we need more research about alcohol use during this period where people are trying to conceive, and understand how women in particular approach it. One thing that came across a lot in these discussions were suggestions or the advice about drink until it's pink. So people were saying, well, until you've got a positive pregnancy test, it doesn't matter. And I think we also need to inform health messaging within dialogues with health professionals, but also public health campaigns, and how we address, I suppose, like uncertainty in the public health advice that we've got, and prevent any sort of misinformation spreading within, for example, online forums, but also in other ways. And also just thinking about how we can equip health professionals with this information to have better dialogues. And it could be relevant to other lifestyle behaviors in pregnancy as well. And then finally, I just wanted to say that, as you noted, the no and low alcohol products was a particular thing that came up in a lot of posts, and I haven't really addressed it here, but watch the space because we will be looking at that particularly. So that's definitely to come. So that was all that we had for today. So thank you so much for paying attention, hopefully all the way until the end. And also to say that Jem has kindly published a blog today. I don't have a link, unfortunately, but there is a blog on IAS's website on this topic, so you can read more, and there will be a paper coming at some point.
Wow, thank you so much. What a wonderful tour de force around this topic area. You are to be congratulated with a really insightful analysis. And we already have lots of questions coming in from our international audience. It's really very exciting. Now, I'm going to pronounce people's names, and if I do it incorrectly, please do feel free to correct me. But we had a question very early doors from Cheryl McQuire from the University of Bristol. If you would like to unmute yourself and speak to our fabulous speakers, Lisa and Rachel, please do.
Yeah, sure. Thanks. Nice to see everybody, and thanks for a really interesting presentation. It was more just around your sort of working title around presenting honest conversations of alcohol use in pregnancy, and just your reflections on to what extent we can consider these conversations to be honest.
Yeah, thank you. So I suppose the reason that we called it that was thinking about, I guess, when we conduct qualitative research, for example, we obviously are aware of the biases that might come in and that we might influence the answers that people give us in an interview setting, for example. Not to say that that always happens, of course not. I think it does seem that people are, I mean, we can't know for sure what these people do in their actual lives, and you can tell that sometimes people tread very carefully about what they're saying. Well, like I said, they sort of, oh well, I just drink tiny amounts. That might be different to what they actually do, and that's just how they want to come across. But the fact that they are anonymous, I think, suggests that they might be a bit more honest, and some people would not necessarily have discussed it with someone else, or they weren't sure if they wanted to go and speak to their health professional. So I think it does suggest that some might be able to reach out, but as I said, it showed in the slide, very few were like talking about heavy drinking, for example. That wasn't unintentional. There wasn't a lot of people who came on there because they were alcohol dependent and had that sort of exposure. So it definitely doesn't cover all the different types of drinking that we might see in pregnancy.
Okay, thank you.
Yeah, and just to jump in there as well, I think that the idea that people may be wanting to encourage a perception of themselves in a certain way, that in itself is a really important thing to acknowledge, that how people want to be perceived when they talk about these really difficult things, or could be really difficult things, is important. And that's still honest to some extent, because they're writing it, right? That this is how it's being recorded, and we can sort of definitely draw attention to how people at least want to be perceived on that base level, even if we don't know their innermost thoughts when writing about it.
Thank you for that question, Cheryl. Could I move to Siri? Would you like to unmute yourself?
Yeah, thank you. Thanks so much, Lisa, Rachel, brilliant presentation, really enjoyed it. When you presented the bit towards the start of the results about evidence and kind of the NHS says this, I was interested in whether posters talked, if there's anything else you can say about the kinds of advice they'd had from healthcare professionals, midwives or others. Did they talk about authoritatively, kind of appeals to authority, my midwife said this, or any things like that about the advice that they'd had, or were those kind of discussions a bit more absent?
Thank you. No, they definitely did, and it was clear that I don't think I even mentioned that, but it was clear that they did perceive healthcare professionals as having the correct information. So whether that was the ones who were saying, well, my midwife said it was fine to drink a little bit, or the ones who said, well, my midwife said it was, safest not to, but it always seemed that they relied on health professionals as having the correct information. So they certainly did, which I think is a good thing and something that we can utilize to make sure that in those situations, people feel that they can speak to their health professional and that they can get good advice when they need it.
I also think it's worth highlighting the fact that sometimes posters would say, well, my mom was told this back in the day, to sort of combat or sort of draw attention to the fact that guidelines change quite a lot. So it was sort of, there's still an embedded authority there, even if it doesn't kind of go with the current authority of the guidance, if that makes sense. That it was still sort of, that embedded authority was also evident there.
And I'm trying to do these in order, but there's one that's slightly related to this question, and then maybe I'll come to some of those who've got their hands up in the room. So we had a question from Jenny Maggs. Would you like to unmute yourself?
Yeah, thank you. I was very interested in talking about the support or shaming that people talked about early in pregnancy when they had been drinking, maybe when they didn't know. And I was wondering if people talked also about later in pregnancy, when pregnancy is visible to everyone, but did they talk about support or shaming when, and whether the risk varied, you know, whether people believe that the risk was less later in pregnancy versus early. It seems like when you're most visibly pregnant, the risk might be less, and then the early stages. I just wonder if people talked about that, or is that beyond the scope of what you?
Yeah, good question. It didn't really come up as much. I think I'm trying to recall. I definitely think that there were people who were like, you know, in line with the previous guidelines, like they didn't drink early on, except for if they had potentially not known that they were pregnant. So maybe that some people spoke about it like that, you know, they drunk later on because possibly that's in line with the previous guidelines. There was definitely, I can remember one post where someone was saying, oh, I'm considering having a drink at a wedding to toast to the couple, sort of thing, but I'm worried that people would judge me and think I'm a bad mother if I do. So there was a bit of that, but I can't remember that it was many posts that spoke about that, specifically about the risk later on in pregnancy. I don't know if you want to add to that, Rachel, if you.
Yeah, I mean, so when we were looking at justifications around drinking, because this was something I was really interested in as well, because it seems as though if there was any departure from the expectation of complete abstinence, there was mention of at least one justification, and one of them was around timing in pregnancy, but usually that was coupled with another type of justification. So it would be like, oh, I only had very small amounts of alcohol, and it was also not in the first trimester, and that was quite important in how people rationalize that risk or seem to discuss that risk. Again, we don't really know if they rationalized it in the minds, but when they were talking about it, it was seen as another reason why they were allowed to break this expectation of abstinence. But it was very much less prominent in relation to the other justifications. So what was much more important was it was only a sip, it was only this, you know, the timing was definitely took a backseat, but it was about not being in the first trimester.
Thank you for that. And Mark Pettigrew, would you like to unmute?
But I thought I'd just speak very briefly about the guidelines, as I was on the committee that produced the CMO's guidelines. And I suppose there's two things. One of them is about the data source in Mumsnet, which I think is very interesting. The other one is about sort of language. And I suppose it's just a caution about using terms like abstinence, which is an anti. It's quite an alcohol industry framing of the guidance, and the word abstinence doesn't appear in the CMO's guidance. So, a sort of framing guidance as promoting abstinence, I think, is slightly problematic. But my other sort of comment was about I suppose it's the data source and the nature of Mumsnet, and goes back to what others have said and previously. My memory of when the CMO's guidelines came out in 2016 was that there was a lot of misinformation deliberately circulated about the guidance, also about the pregnancy guidance. There was misinformation being circulated by various organizations, not just alcohol industry organizations. Other organizations object to the idea of a precautionary principle or precautionary advice for other reasons. So I just wanted to introduce a thought experiment. If you wanted to create doubt about the guidance, if you were an organization, whether alcohol industry or any other organization, what would be a good way to create doubt about the guidance? And I suggest that you would get on Mumsnet and you would start introducing discussions to promote uncertainty about the pregnancy or any other part of the guidance. So my point really is that it doesn't just apply to sort of Mumsnet, but quite often there are studies that sort of treat media analyses and so on as if it's an unalloyed source of public views about alcohol. And but I think, you know, Mumsnet is sort of problematic in some ways because it's also can be used as a way of shaping public opinion, as a sort of a way of introducing misinformation. You mentioned, I can't remember who it was, mentioned misinformation earlier. So I just wondered, you sort of addressed this to some extent, but I wonder to what extent we can take Mumsnet as an unalloyed source of people's views, as opposed to something which is also deliberately and can be manipulated by people who have a particular position to argue for.
I mean, yeah, I guess you're right that that would be a potentially good place to spread misinformation. I don't know how we would, and maybe you have a suggestion. I don't know how we would know if that does happen. I think other than that point, Mumsnet in itself is obviously not a representative sample. They're very I mean, there's not been a lot of research into what the characteristics of Mumsnet users, who they are in terms of socioeconomic factors, etc. But so, you know, it will still be a particular part of the population that access this type of advice. But I hadn't thought about these things in the way that you framed them, so I can't say that I have a very good answer to your question, Mark. I don't know if you want to come in, Rachel, if you got any thoughts on that.
Yeah, I mean, I think one of the questions, or the root of one of the questions is, you know, do we trust what people are saying on Mumsnet, and should we view that as a valuable source? And I think that there are a lot of growing disciplines that look at online forums and that type of stuff, and I think that it is still a valuable tool. I don't think that it would be right to claim it as generalizable in any type of way. And I think that if posters do raise questions about a precautionary approach or guidance, that's what people have done. I mean, I don't think that that's limited to just Mumsnet. And I think if people have like infiltrated a forum to spread misinformation, I don't know if anyone who looks at online forum as like a methodology or anything like that could, I don't know is how I would kind of, you know, that is something I guess researchers do grapple with. And I think when we write up our paper, we'll be sure to say that we don't think that it's generalizable at all, but I think that there is still value in analysing the posts, essentially. Thank you.
It's not there. I'm going to move to James Nichols, please.
That's a brilliant piece of research, so thank you for that. I'm going to, a slight counterpoint to Mark's point. I think that there can be reasonable criticism made of the guidance, and I think it's reasonable for people to raise that. And I think at the time, the concerns that were floating around were it could produce undue levels of anxiety for people who are exposed to drinking before they got pregnant. It could lead to high levels of social judgment for women who were pregnant, and that it could, it kind of assumed that pregnant women struggled with complexity in ways that was arguably, you could have questions about that as well. So my kind of question is, I think, given that the discussion that you looked at seems to show that the women on those forums are able to deal with complexity, actually, and they're dealing with it in their own way. They're talking about different levels of risk. They're talking about, does the evidence actually really show that very low levels of consumption are associated with food alcohol spectrum disorder, which is not clear in the evidence, and that's so my question is actually to go back to public health messaging and ask, is it not just about avoiding misinformation, but also is there some reflection to be done around avoiding public health messaging being discredited by the people it's being targeted at, if they see it as being unduly harsh, or if they see it as being, selecting the evidence in a way that is always pushing towards saying, don't do something, don't do something, don't do something, and people will push back against that. So I'm just wondering if you think there's some reflection to be done on the part of public health messaging itself as well.
Yeah, I mean, as we sort of said as well, that it seems like the particular part of the guidance about when you could become pregnant is where there's a lot of uncertainty. And what we did see, and it would be really interesting to hear people's, who are actually experts on that sort of thing, but people are saying, well, in the early stages, it's not there's no implantation, or it's not like attached to you, so it can't, like, alcohol can't get through until there's a placenta. There's a lot of like specific information that people are providing, like, unless there's a placenta, there's no harm, and things like that. So I think there is complexity about early stages of pregnancy that people are trying to figure out, and some coming with non-evidenced information saying it's fine because there's no placenta, or it's fine in the first few days or whatever. I would say that there is anxiety among women who are trying to conceive, and maybe for a very long period of time, where they were kind of living, I don't know how to express it other than that they were kind of hypothetically pregnant all the time, because they were sort of waiting for that pregnancy test, and am I pregnant or am I not? And I'm saying that because some people didn't know if they were pregnant. Even if they had a negative pregnancy test, they would say, well, I feel pregnant, so you know, can I still risk it with a drink? So yeah, I don't know if it answers your question. I think it's quite simple and straightforward about when you're pregnant, not so much when you're trying to conceive and could become pregnant. Seems to be the sticky point in this context, at least. Rachel, would you add to that?
Yeah, I will jump in a little bit because I do think that it's worth reflecting on like the overt criticisms of the guidance, and really, you know, if we want to improve or assess how guidance is being received, it is important to look at what's critical as well. And I think that it's important. I think some of the posts reflected on the changes that were made between 1995 and 2016, and that created some degree of mistrust among these specific posters anyways, sort of rationalizing why the change was made and whether or not they believe that that was good enough. So again, so some of the posts would speak about, well, it's clear that the CMO doesn't trust women to make their own decisions, or they don't trust that some won't take it to excess and that type of stuff. So then, in which case, you know, you can question whether a precautionary approach is being accepted by this group of people. I would probably say no, in which case you might also look at other models, so like harm reduction approaches as opposed to just precautionary and better safe than sorry, better to avoid. So I know like Natalie Davis at the Society for the Study of Addiction, she wrote an excellent paper around a harm reduction model in terms of drinking in pregnancy or before pregnancy trying to conceive, because that existing state of being in limbo for so many years if you're trying to conceive, as Lisa kind of spoke about. So I think that there is value in reflecting on comments, sort of to take messages forward, you know, and kind of really, if we're doubling down on a precautionary approach, which I think is fair to say that UK policy is, there does need to be more research into see how it's being interpreted. And, you know, that's sort of what we were trying to do with our Mumsnet studies, sort of see how this is being talked about, whether discussions around policy have been brought in, you know, and what are they kind of saying about it. And what we found most interesting, as we sort of said, or one of the things we found very interesting, is that anecdotal evidence is talked about as being more value than the official guidance. And why is that? Well, some people don't necessarily trust the guidance, or, you know, so I think it's that sort of that web or that weave of following people's opinions and why, and sort of questioning it. So I think there is room for reflection, is a very roundabout way of saying that. Thank you, James.
I'm just going to take the last question now because we're a couple of minutes over time. So Alice Dennis, over to you.
Hi, thank you. I work for Rotherham Alcohol Drug Service, but I'm part of a very early days funded group working towards better coverage in South Yorkshire for prevention, support, diagnosis, this sort of side of things around FASD. So that's not just within our service, but across a lot of different services. And obviously that wasn't sort of the focus specifically of your study, but I'm really curious as to whether you saw a lot of discourse around what FASD actually is and how that manifests, or whether it was more like drinking can cause it without necessarily a lot of knowledge as to how that might be picked up subsequently, how it might impact the child subsequently, rather than just being like a fear word that people weren't going into that much.
Yes, thank you. It definitely did come up. Though I can only think of a few posts where they did kind of provide more information about what it was. There was definitely someone who'd had very heavy exposure until late into pregnancy, where they had gone to sort of read up on the potential effects of alcohol exposure and making more explicit sort of references to, you know, impact on development and things like that. But we did also see sort of just mentions of FAS or varying degrees of FAS. Sorry, I didn't mean to do a quotation marks for FAS, but for varying degrees of FAS. So it wasn't always sort of further explained what that means. So most of the time, I would say they only mentioned it as a potential outcome, but often harm was, or the risk of harm was just talked about as like there is a risk of something rather than specifically. But miscarriage did come up as well, so it's not just FASD. Miscarriage did come up in a few posts as well, where people were worried about whether they had caused their miscarriage and things like that. So yeah, it didn't come up as much as you perhaps would think, as awareness has increased.
I think prevention, we found a lot of, I mean, as I say, it's really early days, but we found that it's the boogeyman phrase, but actually when people are aware of how lifelong impact it can have on sort of the postnatal child, that's almost clarified things a little bit for people.
Yeah. Well, thank you all so much for coming along, giving up your afternoon to hear such phenomenal speakers. If you've got your camera on, we're going to give our appreciation to Lisa and Rachel by clapping our hands, or you can use the little reactions tool to say thank you for all their hard work and phenomenal insights, and say thank you so much for a really, really insightful presentation. And I think I speak for everyone in the room when I say we can't wait to see the publication out in print and cited widely in all of our works going forward. So thank you all so much for your time this afternoon, and have a great rest of your day.